Choosing the right hospital or clinic is as important as finding the best plastic surgeon for anyone planning to have a cosmetic operation.
What can I do for you?
I've been thinking about having some work done on my breast.
Right.
Peter Arnstein has been a consultant plastic surgeon for 15 years, and he's only too aware of the need to do your research carefully.
It can be quite difficult for prospective clients in aesthetic surgery to actually find a clinic or hospital that they can trust. And because there's so much advertising, and it is only advertising, my advice is to research it very thoroughly and even go and see the hospital, preferably a hospital rather than a little clinic. They need to be absolutely sure that the people working in it are specialists. So it's not just the surgeons, but also the nurses are specialists in that way. Hello. So it's a complete team. And you're not being operated on in an environment where they will do hips followed by bowel operations, etc., that they actually concentrate on the aesthetic surgery. Some clinics pretend that they have even overnight accommodation, and then when the operation's been done, they find that the client is actually being shipped out to a hotel nearby, and there is no such thing as overnight care. This can be enormously dangerous if they have a bleed or a collapse in a hotel rather than in the safety of a hospital. Once you've made contact with the hospital, it's important to go and see the actual surgeon who's going to do your procedure. There's little point in seeing someone who's a salesperson who probably is working commission and is desperate to get you through to the theatre, even though it may be not appropriate surgery, for you. Why don't you try this one? It's 300 mils, you don't have to worry about the size. Pop it into your bra and make a kind of breasty shape. Okay. When you conclude your outpatient appointment, you should feel comfortable and confident in your surgeon, that all your questions have been openly and appropriately answered, and there's nothing disguised about it, that your surgeon is quite clear as to your wishes, and that you're clear that it can be carried out appropriately. You also need to know that the cost you've been quoted is the real cost and covers everything, and that if something else crops up in terms of a question before theatre, you have absolute freedom to go back and get that cleared up before you go anywhere near the theatre. Another possibility is that you ask maybe the surgeon's secretary or PA to take you around the hospital, so you can have a look at the cleanliness and perhaps even the happiness of the staff there. If they look jolly and industrious, you know it's a happy place, and they probably will look after you that much better.